Chapter 3, Your Journey Through the Peri-Operative Phases. My name is Dr. Moga. I'm an anesthesiologist. I've been a physician for 18 years within the United States. So let's get on with it. Having been through surgery as a patient, and on the other hand, as an anesthesiologist, this is what I have to say to it. So when you show up on the day of surgery, you're usually met by a receptionist. They'll verify your name, the name of your surgery, your payment details. They will print out documents for you and give you an ID. And then you are taken to a triage area. This could be a pre-operative holding area, which in short, which we abbreviate it to pre-op. In this area, you would have your identity verified again by two identifiers, and at which point you will be asked to change into a hospital gown, and you may or may not be required to remove your underwear. Your hospital gown usually faces to the back. Okay, and then you are either placed on a stretcher or in a chair, and an IV will be started. The pre-operative nurse will confirm the surgery you're having. They will consult with your physician in terms of your consent form. They would usually go through a checklist of questions, and some of the questions you will have confirm your medical conditions, any allergies you have, write down your medications, confirm any metal hardware you have in your body, if you have any reaction to anesthetics. They may conduct a mini physical exam, and at which point they put you on a stretcher. So I'm just going to assume, for example, when you have a regular surgery like a cholecystectomy, which is removal of your gall. After your peri-operative nurse is completed starting your IV, then usually at that point you will meet with your surgeon, who may mark the site of the surgery if it's on a unilateral site, such as a leg, an arm, or one kidney, or an organ that has spared. They will mark the site with a marker. You will get to sign your consents. This is your opportunity to ask your surgeon of any other questions you may have, particularly post-operative instructions, because after the surgery, you as a patient may be too sedated to remember instructions that are given to you after surgery. It is best if your family member is there to advocate for you, because you may forget questions that you have, and you may forget some of the information being provided to you because you are nervous. At this point also, you will meet with your anesthesiologist, who will come and introduce themselves, which may be your anesthesiologist or a CRNA or an AA. And most places we work in a care team model, which is the anesthesiologist supervises while you have a certified nurse anesthetist or an anesthesia assistant being part of your care. You will sign the anesthesia consents, and this is also your opportunity to ask any particular questions you have. One of the main questions anesthesiologists will ask is whether you have anyone in your family who has had any fatal reactions to anesthesia, and one of the ones we always look for is malignant hyperthermia. Do inform if you've had any side effects of medication, such as perhaps if you get a rash with morphine or you get itching. There are other pain medication choices that your anesthesiologist can choose for you after your surgery. Then you get an opportunity to meet with your operating room nurse, who is often referred to as a circulator. Your operating room nurse also has a duty to confirm your identity, that you know what surgery you're having done, and one of these nurses will witness your consents to make sure you're the person who signed them, or that your power of attorney or a person authorized to do so has signed your consents. Your peri-operative nurse will bring you back to the room, but first you may be given medications in the peri-operative area, which may include pain medications, medications to decrease stomach acid, medications to allay your anxiety. After that point, your operating room nurse will bring you to the operating room. If you have had a medication to help with anxiety called Versed, you may actually forget everything that happens from then on, even though you participate in them. You may forget moving from the stretcher to the operating room bed. For many surgeries, we have you move to a flat table in the operating room, which is called the OR table, where your surgery will occur. At that point, you'll have monitors placed on you. If you are going off to sleep, you may have a face mask and oxygen. And after getting your vitals, your anesthesiologist will inject you with medication that if you're getting a breathing tube or a breathing device, they'll place it after you have gone unconscious, and they'll secure your airway. In some surgeries, you are having a block. That block may be performed before or after surgery. If it's performed before the surgery, then you're positioned and the anesthesiologist will perform the regional block. In some surgeries, you are having a spinal medication in your back or an epidural for the surgery, such as a C-section. In that case, prior to laying you flat, you'll be made to sit on the bed and supported with a pillow on your front, and your anesthesiologist will perform the spinal anesthetic. Then for most surgeries in the United States, then you are positioned by the surgical team. 80% of surgeries require you to lay flat on your back, which is considered supine. You may be positioned prone for spine surgeries or any surgeries on your back or the back of your neck. You may be positioned lateral, which is a position for surgeries on one side of your spine, on your hip, for instance. You may be positioned in a lithotomy. I think I'll do a different chapter on positionings in surgery. After you have been positioned, then the surgery will start. Well, first, before the surgery starts, your peri-operative nurse, your circulator, will prepare the surgical site. Preparation of a surgical site may include clipping any bodily hairs, wiping with alcohol, and then using an alcohol-based prep to kill any germs on the skin surface where the surgery will occur. And then at this point, your surgeon will be scrapped in and the surgery will proceed. So we are talking about all of these things happening when you're mostly unconscious. Okay? Your anesthesiologist will be there by your side the entire time, taking care of you. Monitoring your vitals, your pain level, and monitoring your hemodynamics throughout the surgery. At the conclusion of your surgery, then becomes the emergence process. This is when your anesthesiologist might be giving you medications to reverse any other medications that are in your system, turning off any gas anesthesia, and having you breathe out the anesthetic. At this point, you start to awaken. Your breathing device is removed. As well, any surgical dressings are placed. Then you are moved to a hospital bed or a stretcher, and you are taken to the PACU. The PACU is the post-operative anesthesia care unit, which is the wake-up area. That is where you will be for half an hour to an hour until you have completely recovered from the acute effects of your anesthetic and stable enough to be moved to an area where you do not need to be monitored intensely by a nurse. Okay? And I'm out of time.